Have you ever heard of a situation where a perfectly healthy person suddenly develops blood clots over and over again, or experiences devastating unexplained pregnancy loss? Well, today we're pulling back the curtain on the hidden culprit behind these medical mysteries, a condition called Antiphospholipid Syndrome, or APS for short. We're going to get into what it is, exactly how it wreaks havoc, and why spotting it is so incredibly important.
So here's our game plan. First, we'll look at the mystery itself. Then we'll dive into the body's internal attack plan, what's actually going on. We'll cover the really dangerous consequences, then figure out how doctors unmask this thing, and finally we'll look at how it's treated. All right, so let's jump right in with the big question, the one that usually kicks off this whole journey for a patient. I mean, this is the real puzzle, right? You have people who are young, active, totally fine, and then bam, a life-changing medical event happens, and it seems to come out of absolutely nowhere. The answer, it turns out, is often found when the body's own defense system decides to go rogue.
And here it is. This is our culprit, Antiphospholipid Syndrome. You see it right there. It's an autoimmune disorder. Think of your immune system as your body's security team. Well, in APS, that security team gets confused. It starts attacking your own healthy cells instead of outside invaders, and that mistaken attack is what triggers a chain reaction that leads to very, very dangerous blood clots.
Now, it's really important to get this. APS doesn't just show up in one way. It has two different faces, you could say. You've got primary APS, where the syndrome is the main event. It just shows up all by itself. But then there's secondary APS, where it comes along with another autoimmune disease, and the most common partner in crime is lupus. Knowing which one a patient has is a huge piece of the puzzle.
Okay, so we know what it is, but how in the world does a confused immune system actually cause a blood clot? Let's break down the step-by-step battle plan that's happening inside the body.
It really boils down to this four-step process. First, those rogue antibodies pop up. Next, they zero in on phospholipids, which are basically these fatty layers on our cell membranes. That attack acts like a false alarm screaming injury to the body. This kicks the whole clotting system into overdrive, creating clots where they shouldn't be. And here's the crazy part. So many platelets, our little clotting cells, get used up making these unnecessary clots that your platelet count can actually drop, a condition called thrombocytopenia.
So as you can imagine, this internal battle doesn't happen silently. The consequences of these clots are far-reaching and, frankly, can be incredibly serious. This is where we get to the symptoms that people actually experience.
But here's what makes APS so terrifyingly sneaky. A person can have these rogue antibodies for years with absolutely zero symptoms. Think about that. You're just living your life completely unaware that something is wrong, and then the very first sign of trouble is a massive, life-threatening event. There's a reason they call this a hidden disorder. And when those clots do happen, they tend to show up in a few common and very dangerous locations. A clot deep in the leg, that's a deep vein thrombosis, a DVT. If a piece of that clot breaks off and travels to your lungs, that's a pulmonary embolism, which is a true medical emergency. And if the clot blocks an artery in your brain, that's a stroke. For women, the consequences can be just uniquely heartbreaking. APS is one of the leading treatable causes of recurrent miscarriages. See, those clots can form in the tiny blood vessels of the placenta, essentially cutting off the lifeline to the developing baby. And the criteria for diagnosis are heartbreakingly specific, pointing to a clear, tragic pattern. Now, most of the time, APS involves single clots that happen over a period of time. But there's a rare, terrifying version where the body just launches an all-out, multi-front war on itself. And it's called catastrophic APS, or CAPS. This isn't just serious, it's a 5-alarm fire. The clotting system goes completely haywire, forming widespread clots in 3 or more different organs. We're talking kidneys, lungs, brain, heart, all within a single week. It leads to rapid multi-organ failure, and it is absolutely fatal without swift, aggressive treatment. So, with a disease this complicated, and often this hidden, how on earth do doctors finally nail it down? Well, the diagnosis is really a two-part story. It's like a detective needing both a witness and forensic evidence.
To get an official diagnosis, you need to check boxes in both of these columns. First, you need the clinical criteria. That's the patient's story. Either a confirmed blood clot, or that specific pattern of pregnancy complications we talked about. But that's not enough. You also need the laboratory criteria, a blood test that comes back positive for one of these specific antiphospholipid antibodies. You need one from each side to make the call.
But there's a really important catch. One positive blood test doesn't seal the deal. Why? Because sometimes these antibodies can show up for a little while if you have an infection and then disappear. So to prove it's a persistent problem, the test has to be positive on 2 separate occasions, at least 12 weeks apart. That 3-month wait is crucial for an accurate diagnosis, but you can only imagine how stressful that waiting period is for a patient.
All right, so once the diagnosis is finally confirmed, the conversation completely shifts. It's no longer about what is this, but what do we do about it? The goal is all about preventing future clots, and the treatment plan has to be tailored to each specific person.
This table breaks it down perfectly. You see, it's not one size fits all. If you have the antibodies but you've never actually had a clot, a simple low-dose aspirin might be all you need. But if you've had a clot in a vein, like a DVT, that usually means lifelong treatment with a blood thinner, like warfarin. And that word, lifelong, that changes everything. If the clot was in an artery, like a stroke, the treatment is even more aggressive. And look, pregnancy gets its own special protocol.
And here's why pregnancy is treated differently. It's all about safety. The go-to blood thinner, warfarin, can actually cross the placenta and cause harm to the fetus. So, during pregnancy, the standard of care is to switch to a different type of anticoagulant, heparin, which does not cross the placenta, making it much safer for the baby.
And what about that rare catastrophic form we talked about? Well, you throw the kitchen sink at it. This is an all-hands-on-deck situation. You hit it with high-dose steroids to slam the brakes on the immune system, IV heparin to fight the active clots, and then these really advanced therapies like plasma exchange or IVIG to literally try and wash the bad antibodies out of the bloodstream.
And all of this leaves us with this one final, really big question. Our current treatments are fantastic at dealing with the consequences of the disease, the blood clots. But the real problem is the immune system itself. So the ultimate challenge, the thing researchers are working on right now, is this. How do we stop the body from making these misguided attacks in the first place? Answering that? Well, that's the key to a future cure.